Ever pondered how medical treatment would be possible in the wilderness, far from any hospital or clinic? Just imagine you're out there, miles away from the nearest medical facility, and an emergency strikes. It's a scenario that demands more than just a standard medical training. This is where wilderness medicine comes into play, a specialized field that combines the elements of emergency medicine, environmental science, and even survival skills. It's a discipline that prepares healthcare professionals to effectively respond to medical emergencies in remote and challenging environments. Whether it's a snake bite in the tropical rainforest, a broken bone on a mountain trail, or hypothermia in the Arctic tundra, wilderness medicine is the new frontier in healthcare. It's about learning to adapt, improvise, and overcome. It's about bringing healing and hope where there's often despair. So fasten your seatbelts and put on your hiking boots. Welcome to the intriguing world of wilderness medicine. Imagine a fellowship that takes you beyond the hospital walls into the heart of nature. Yes, you heard it right. This is all about the Wilderness Medicine Fellowship, a unique medical training program that pushes the boundaries of traditional healthcare. This fellowship is not for the faint-hearted. It's for those who dare to venture into the great outdoors, where medical facilities are often scarce and the challenges are plentiful. It's a program that molds medical professionals into resilient, resourceful, and adaptable practitioners capable of delivering quality healthcare in the most remote and austere environments. The objectives of the Wilderness Medicine Fellowship are multifaceted. Primarily, it aims to equip medical professionals with the necessary skills to manage a wide range of emergencies in the wilderness. These could be anything from altitude sickness to hypothermia, snake bites to fractures. It's all about learning to improvise and adapt to your surroundings. The fellowship also focuses on developing leadership and decision-making skills. In the wilderness, there are no specialists to consult, no advanced diagnostic tools at your disposal. It's just you, your patient, and the tools you have at hand. You have to make the call, and you have to make it fast. But it's not all about emergencies. The fellowship also emphasizes the importance of preventive medicine and public health in the wilderness. It's about promoting safe outdoor practices, understanding the impact of human activity on the environment, and learning how to mitigate these effects. The Wilderness Medicine Fellowship presents a unique set of challenges. It takes you out of your comfort zone, tests your boundaries, and pushes you to your limits. It's demanding, both physically and mentally. But it's also incredibly rewarding. It opens up a whole new world of possibilities, where no 2 days are the same and every day is an adventure. This is no ordinary medical fellowship. This is a journey into the unknown. Meet Dr. Jane Doe, a wilderness medicine fellow whose experience exemplifies the challenges and rewards of this unique field. Imagine a world where medical textbooks can't prepare you for everything, where the unpredictable nature of the wilderness presents its own set of medical challenges. This is the world Dr. Jane Doe chose to immerse herself in when she decided to pursue a fellowship in wilderness medicine. With a passion for adventure and a heart for service, Dr. Doe embarked on her wilderness medicine journey. The wilderness, she learned, doesn't play by the rules of conventional medicine. The hospital's sterile walls were replaced by dense forests, icy mountains, and scorching deserts. Instead of hospital beds, she had rocky terrains. Instead of a fully stocked pharmacy, she had a backpack filled with limited supplies. Dr. Doe recalls a time when she was faced with a severely dehydrated hiker while on a remote trail. With no access to intravenous rehydration, she had to think on her feet. She utilized the principles of oral rehydration therapy, using what the hiker had in his backpack, salty snacks and water. She monitored him closely until he was well enough to be evacuated. It was a challenge she hadn't faced in any hospital emergency room, but one she overcame with her wilderness medicine training. She also speaks of a time when a rock climber had a nasty fall, resulting in a compound fracture. Far from a hospital, Dr. Doe had to stabilize the injury, control the bleeding, and arrange for a helicopter evacuation. This was wilderness medicine in its rawest form, challenging, unpredictable, but also incredibly rewarding. Dr. Doe's experiences weren't all about the adrenaline rush. There were also moments of quiet satisfaction, like when she taught a group of young hikers about preventing altitude sickness, or when she helped a fellow mountaineer understand the importance of hydration and nutrition in the wilderness. These moments, she claims, were as rewarding as any life-saving procedures she performed. The rewards of her fellowship weren't just professional. She found personal fulfillment too. She saw the most beautiful sunrises, walked under a blanket of stars, and experienced the humbling grandeur of nature. She learned to appreciate the silence of the wilderness, finding it a stark and beautiful contrast to the constant hum of the hospital. Dr. Doe's Wilderness Medicine Fellowship wasn't just about acquiring skills. It was about adapting, improvising, and making the best possible decisions under challenging circumstances. It was about the spirit of adventure, the joy of learning, and the gratifying experience of providing medical service where it was most needed. Her journey was not without trials, but the rewards made it worthwhile. She emerged from her fellowship not just as a better medical professional, but as a more resilient and adaptable individual. She found a unique satisfaction in knowing that she could provide care in the most challenging environments. Dr. Doe's story is a testament to the spirit of adventure and service that embodies wilderness medicine. What does it mean to practice medicine where there are no labs, no imaging, and no specialists around the corner? This question brings us to the heart of the challenges in wilderness medicine. Imagine being in the great outdoors, miles away from the nearest hospital, with the responsibility of diagnosing and treating a patient using limited resources. It's like a high-stakes game of chess against nature, where every decision counts. The absence of modern diagnostic tools is one of the most significant challenges. No X-ray machines to see broken bones, no blood tests to identify infections, no MRI scans to detect internal injuries. Doctors have to rely on their intuition and clinical skills, making diagnoses based on patient history and physical exams alone. Treatment options are also limited. Without a fully stocked pharmacy, wilderness physicians often have to improvise. They might use a splint made from branches for a broken bone, or clean a wound with boiled water. Every day is a test of their creativity and resourcefulness. And then there's the issue of time. In a hospital, help is just a call away. But in the wilderness, help can be hours, even days away. Delayed medical assistance can significantly impact the patient's outcome. It's a race against time that wilderness physicians often find themselves in. But perhaps the most daunting challenge is the unpredictability of nature itself. From extreme weather conditions to encounters with wild animals, wilderness physicians must be prepared to face any situation. Yet, despite these challenges, there's a certain allure to wilderness medicine. The thrill of uncertainty, the satisfaction of overcoming obstacles, the joy of connecting with nature. These experiences are unique to this field of medicine. And let's not forget the innovation it inspires. Wilderness medicine pushes the boundaries of traditional medicine, leading to new techniques and approaches that can be beneficial even in a hospital setting. The wilderness is a formidable opponent, but it also inspires extraordinary medical innovation. In spite of the challenges, why do doctors choose the path of wilderness medicine? Let's delve into that. At the heart of it, wilderness medicine offers an unparalleled sense of fulfillment. There's a profound satisfaction that comes from offering aid to those in desperate need, often in remote areas where other medical help is inaccessible. But it's not just about the service, it's also about the thrill of adventure. Imagine being able to combine your passion for medicine with your love for the great outdoors. It's a unique blend that few professions can offer. Moreover, wilderness medicine is a constant test of one's resilience and adaptability. It pushes you beyond your comfort zone, demanding resourcefulness and quick thinking. It's a path that fosters personal and professional growth in ways that conventional medical practice often doesn't. In wilderness medicine, every challenge surmounted is a reward in itself. It's an endeavor that truly enriches the soul while saving lives. Wilderness medicine is not for the faint-hearted, but for those who dare. It offers an unparalleled experience. Let's revisit what we've learned today. This unique field stands as a new frontier in the medical world. It's a discipline that combines the rigors of traditional medicine with the unpredictability of the great outdoors. We heard from Dr. Jane Doe, who shared her own experiences navigating the wilderness medicine landscape, painting a vivid picture of both its challenges and rewards. Indeed, the trials are significant, from dealing with limited resources to making crucial decisions under pressure. Yet the rewards are equally compelling. Imagine the thrill of saving lives in the most remote corners of our world, or the satisfaction of evolving your skills in a dynamic environment. In the heart of the wilderness, medicine becomes more than a profession. It becomes a calling. So, if you've got the courage and the passion, the wilderness is waiting for you.